the basic assessment. What are the basic assessment you should do? You should take history. You have to observe the position of the limb. You have to compare with the normal side. Okay. You have to check for active range of motion, passive range of motion. You have to check for the muscle strength. Okay. You have to check for the sensations. You have to check for the reflexes, neonatal reflexes like Morris reflex, ATN nerve, STN nerve, and the functional evaluation of the kid. Okay. Once we have taken this, then we can go for the treatment for the management of the patient. So what management we can give for brachial plexus injury? Any idea? What management we can do? We should not give any kind of treatment for brachial plexus injury. We should not give any kind of range of motion exercise also. Okay, the patient should be, make sure that the patient should be lying on the normal side, not in the affected side. Okay, and the hand should be on the abdomen. Okay, so should not be any kind of treatment. After 10 days, we can start our treatment. After 10 days, we can start our treatment. So what are the common important impairments? Important impairments seen in Erb's palsy or brachial plexus injury. One of the important things, muscle weakness. What are the muscles that are weak? Deltoid. Okay. External rotators of the shoulder. Okay. Elbow flexors, supinators. Understand what I am talking? Yes. And wrist extensors. Yes. So these are the muscles which are weak. Understand what I am talking? And these kids will have abnormal posturing. Okay, the posture of the limb will be abnormal. And one of the important thing is that the muscles will go for tightness or contractures. So what are the muscles which goes for tightness and contractures? Shoulder adductors, internal rotators, okay, elbow extensors, pronators, and wrist flexors. Okay, these are the muscles which can go for tightness or contraction. Okay, so the important thing is that how to manage abnormal posture. One method is by giving proper positioning. What is the position of the patient for a brachial plexus the Erb's palsy? Make sure that the shoulder should be abducted, extended, rotated, elbow should be flexed, forearm is supinated, the wrist and hand should be on the back of the head. Understood what I am talking? Like this. Abduction, external rotation, elbow flexion, supination of the forearm, wrist and finger extension which should be on the head. Okay, that is one of the important posture we have to put. Okay, by putting this posture, we are avoiding contracture for subscapularis muscle and pectoralis major muscle. Okay, after that, okay, to avoid this abnormal posturing, you should give stretching exercises for the, you must be knowing how to stretch the shoulder adductors and should stretch the internal rotators. If you want to stretch the internal rotators, we should take to external rotation. If you want to stretch for the adductors, we should take to abduction. So please, these things are very, very important. Okay, how to stretch abduction, okay, external rotation, okay, and elbow flexion to stretch the
elbow extension,
triceps muscle, and supination, okay, to stretch the pronators, and wrist extension to stretch the